Okay, it's 9 o'clock and we're going to get started. This is a special meeting of the Commissioners Court. Today is the 24th of September. It's 9 o'clock and we are meeting with folks from Texas Association of Counties to introduce to the Commissioners Court some concepts on wellness programs and how it can affect health insurance costs to the county and how it impacts employees. So Carrie and Lisa are here today, and I have got a COG board meeting, budget meeting at 10 o'clock in Bogota, so at 9:30 I'm going to zoom out the door and drive fast. And y'all continue to meet without me, please, and if you'll adjourn at the appropriate time, we'll have everything here on video. So with no further ado, Carrie, I'm going to turn it over to you, and thank you all again for being here today.
Thank you. Okay, thank you, Judge, for having us. Again, my name is Carrie Chin, and I'm a wellness consultant with the Texas Association of Counties Health and Employee Benefits Pool. And with me, I have Lisa McCabe, who is our employee benefits consultant. She and I actually work in the Northeast Territory of Texas, so I've been in touch with Christy, and we're happy to share some ideas with Titus County. We currently have a program called Healthy County, and we offer wellness program services to all of our pool members, but we often do come visit even non-pool county members and just talk to them about wellness programs in general, which is what we'll be doing today. Okay, so just to start off, I'm sure everyone is aware of the Cadillac tax, and this is what is really prompting a lot of our counties to implement some of the wellness programs. The Cadillac tax, as you may be aware, is coming down the pipeline. 2018, it's going to pose a 40% tax on anything that goes over a certain threshold, which will be $850 a month for single coverage, and $2,291 a month for family coverage. At this time, we're not really sure what's going to happen with this, but we have to go on as if it's going to happen. So that's kind of where we're coming from. And you know, there's been a lot of questions about if this is going to end up in the responsibility of the employer or the employee. But one thing we do know, even if it is with the employer, it is surely to trickle down to the employee in some way or another. Okay, so just a brief overview, you know, of
Hey, Carrie, can I interrupt you? Will you kind of explain and maybe put some numbers to that Cadillac tax so that these guys can understand what we're potentially looking at if we do end up not having a plan that stays under the threshold of $850?
Absolutely. So, for example, let's say in 2018 you're currently paying $900 a month for employee-only coverage, okay? So that's the rate that you're paying for one employee in your county. So any amount over that $850, in this case, that would be $50. If you're paying $900, the county will be taxed 40% of that $50, because that $50 is what you're going over that threshold of $850. So you multiply that $50, for example, times the number of employees that you cover, and that is the amount you would pay to the government for this excise tax. And so, you know, unfortunately, a lot of our counties are already at this place. We do have counties that are already paying $850 and up, and so they're looking at ways that they can change their plan to get that rate lower, perhaps increasing a deductible, increasing a specialty copay, specialty drug copays. Those are just some ideas that, you know, our counties are doing right now to try to get those numbers down so that they aren't dealing with a big change, a drastic change when they do get to 2018 and having to say, you know, we're going to have to pull the rug under the employees in a drastic way. They're trying to do little steps right now to keep that under $850. Yes?
What about if you're self-insured and we pay, put aside our crew $900 and it ends up at the end of the year, we have more claims and it ends up $1,000 a month?
It's actually the amount not that's paid out, it's the amount that you pay for coverage. So in this case, I asked Lisa about this earlier, and even for self-funded groups, whatever your contribution is for coverage per employee, is the amount that is going to be referenced as far as in regards to the excise tax.
I believe that if what he's saying is correct. So if it did end up being, if they were at 800 and it ended up being 1,000, it would be based on that 1,000.
Oh.
For the self-evident, I'm sorry, yeah.
Okay.
Yeah.
Yeah, I'm sorry about that.
Because we could say we're only going to accrue 600.
Yeah, that's right. And we listened to an expert talk to us about this about a month ago with CAPS Insurance, and she said that had not been determined yet. But it seems only logical to me that you can't just say, oh, we're going to show in our budget $850, and then the true cost ends up being $1,000.
Yeah. There's still so much to be determined, so CAPS is exactly right. But the way we're approaching it is you just got to move forward as this is the way it's going to be. Because if you wait until 2018, then you're just going to be making all these drastic changes at once.
So we've got to be below the 850
Yes.
a month.
Correct. Okay. Won't spend a lot of time on this slide, just illustrating, of course, what all of our counties are up against. Of course, the cost of inflation, the increase in medical care has gone up. If you see higher claims, that's of course going to affect, what you have to contribute. All of our counties deal with budget issues, and a lot of them are struggling with the decision on whether they want to transfer some of those costs onto counties. We have had some counties that have decided, we need employees to contribute something, even if it's $25 a month. And I'm going to talk a little bit more about what they're doing to help alleviate some of that burden for some employees who participate in wellness. Okay, already kind of talked about some of this already, but traditional strategies, just, do nothing, absorb the healthcare costs, and increase employee contributions. I mentioned that. I mentioned increasing deductibles or co-insurance percentages, increasing out-of-pocket maxes. Unfortunately, we have seen in some cases over the years, some counties have to eliminate benefits altogether. And some counties doing some wellness programs, just participation-based, nothing too aggressive. Okay, and just briefly, a lot of our counties do pay most of their premiums, at least from our pool. Most of our counties pay 100% of employee coverage, and so that's why it's hard for them to move to anything different, because they've always covered that benefit at 100%. One of the things that we try to focus in on is decreasing some of the health risks of our population. So if we can get people to better manage their conditions, we're hoping that we'll see better claims from those counties. If we can prevent someone going to the emergency room, having that hospital stay, even if it doesn't happen overnight, if it happens 1 or 2 years down the road, we're hoping that we can help the county's overall medical spend. Okay, so we basically focus on a couple different ways to do this, and one of the things is to lower the cost of health care by helping people be good consumers of health. So we have some programs in place that help people price shop better. So search areas, see what's in network, and decide on where they go based on the actual cost. So not only saving the county money, because you might get an MRI for $600 as opposed to $1,200, but that's ultimately going to help the county employee in what they pay out of pocket. And then overall, lowering usage, and that's just by, taking better care of yourself, maybe calling a nurse line instead of running to the doctor, maybe going to urgent care instead of the emergency room. So anytime you can lower utilization, obviously you're going to help save money that way as well. Okay, already kind of talked about, the better you can manage your disease, the more likely you're going to be from contributing to your county's overall spend. Of course, we know there's some things that you just can't prevent, and we see that a lot, and that's something, there's some things wellness won't help with, but we do hope that you can get people who have diabetes, have high blood pressure, high cholesterol to get in touch with a nurse, speak to them, better manage their condition, take their medications. Then you will see better outcomes for those employees, and we have seen that with our programs. This is kind of interesting. It says the average healthcare cost Someone who has more chronic conditions is 5 times greater for someone without any chronic conditions. And that information, we also see that data from Blue Cross and Blue Shield as well. When they look at their book of business, they can look at people who have the conditions versus that don't and what they're costing. Okay, so now we're going to talk a little bit more about the wellness incentive programs. You know, you can incentivize people for participation in programs. You can go as far as incentivizing them for actually reaching certain goals, such as weight, blood pressure, cholesterol level. We don't have any counties that are currently doing that. We don't have any counties that are saying, you know, you have to have your blood pressure within this range or pay a surcharge. But you see that a lot now in the corporate world, but not so much county government yet. We do have a couple counties that have implemented a tobacco surcharge. So they've asked their employees who are using tobacco to either pay an additional cost per month or to complete a tobacco cessation program. If they do complete the tobacco cessation program, then they are not subject to that surcharge. They don't have to quit smoking, they just have to complete the program.
What would be a typical surcharge that you've heard about?
$25.
Per month?
Yes, sir. Yes, sir. And again, as long as that employee agrees to complete the tobacco cessation program, then they are not subject to that surcharge. And that is required. That's one of the ACA rules. Just a couple considerations before we get into some of the details. Of course, they are voluntary, and we say that because no one has to participate. Now, because they choose not to participate, though, that means they're opting out. Therefore, they could be required to pay a surcharge on something. Of course, employees need to be informed. They must have reasonable time to take actions on it, and there always has to be reasonable accommodations made for those unable to engage in activities due to a medical condition or limitation. Okay, so we're going to talk a little bit about the positive incentives. Of course, you can see the gift cards that people can receive. We have a few of those that we do at the program right now across the board for all of our counties. If employees complete a health assessment, we do a $35 gift card. If they complete a physical activity challenge twice a year, then they can receive a $30 gift card for each of those. And that's something that the pool administers on a pool level. We see some counties do vacation days, and they simply treat it like an additional vacation day. And then contributions to health savings accounts. I believe Burleson County currently has something set up to where if their employees complete certain activities, they contribute to a HRA. I believe it's an HRA. There's also a lot of talk about penalties or disincentives, and the research is really showing that these are becoming more and more effective. There's been a lot of research done on how people view certain things, and people actually, they view loss twice as, they process loss twice as much as they do gain. So, if someone feels like they're going to be something's taken away from them, that's going to trigger them to want to do something more to hold on to that, as opposed to them saying, oh, well, if I do this, I might get, a coffee mug. But if someone says, well, if you don't do this, we're going to take something away from you that you already have, such as part of your paycheck, that's going to, cause people to take more action. I talked about the tobacco surcharge already, and then a premium surcharge that we're going to go into more detail in here just in a moment. Just briefly, we did have one county last year implement a deductible credit option to where they asked their employees to complete some of these activities, and if they did that, then they received a deductible credit up to $500 in this certain case. So they said if you, take your annual exam, if you complete a health assessment, you can earn down your deductible. The problem with this is that it doesn't touch everyone, because you're going to have some individuals that are never going to meet their deductible. This is not going to motivate them. So this would not be the most progressive approach, but it is something. It's a good start for some counties.
That seems like an administrative nightmare.
It's actually automatic, which is nice. In this case, Blue Cross and Blue Shield was able to set up reporting on their end, so they knew once someone completed that activity, it was all systematically supported on their end, so it automatically brought their deductible down on their end. So luckily, this was something I believe most healthcare carriers can do on their end. Okay, so here's some examples. So I use only non-grandfather plans since Titus County is a non-grandfather plan. Grayson County, this is their second year of doing an employee incentive tied to their contribution. So we call this a premium differential. The county wanted to get employees engaged in wellness and hopefully try to bring down some of their healthcare spend. And so they decided to implement a premium surcharge and tobacco surcharge. So what they asked their employees to do was to, over a certain earning period, usually it's at least 9 months is what we would recommend, they asked their employees to complete an annual physical, complete a health assessment, which is the online questionnaire. In this case, it was on the Blue Cross and Blue Shield website, and complete a tobacco certification. And if the employees agreed and they opted into the program to do all 3 of these, then they paid nothing. They continued to pay $0 towards their employee coverage. In this case, they did have spouses included. They decided they wanted to include spouses because we actually see that spouses that are on the plan contribute to just as much, if not more, of the medical spend. So it's always nice to include spouses in some cases, depending on how many you have covered. If you only have a couple covered, it might not make sense. So in this case, they had up to $75 that employees could contribute if they decided to opt out of the program altogether. They had really good participation rates in the first year in the 90%. You did, of course, have some employees that just said, you know, I don't want anyone telling me what I need to do. I'm just going to pay the $75 a month. And of course, that's the choice of the employee. But just keep in mind that even those employees who were tobacco users and certified as tobacco users, as long as they completed a tobacco cessation program, either online or telephonic through Blue Cross and Blue Shield, and it's covered at no cost, then they were not subject to that tobacco surcharge. Okay.
And if they had a spouse that was in equal health and refused to do this, $150.
Correct. Yes, that is correct. The spouses were charged the same amount. That is correct. Just to note, you are probably aware of this already, but annual exams, as long as they are preventative, are covered under non-grandfather plans at 100%. So in this case, and it would be the same case as Titus County, your employees could go to their primary care physician or doctor and pay 0 copay for an annual exam. They didn't want to make it a financial burden for their employees to meet these requirements, so that was very important. We did have one county that was non-grandfathered, Jackson County. They did a similar program, and they decided because they were asking their employees to complete an annual exam and they would be subject to that $25 copay. In this case, they were going to waive that copay for the employees. They were actually going to reimburse the employees for that copay amount. Okay, the tobacco yes.
On that first one up there, now, in June, I had a complete physical. More detail, I had X-ray on my lungs.
Talk into the...
In June, I had a complete physical. I do that. I started doing it when I was 60. I turned 65. I did it again, but I did get one every year, just a basics physical. But I feel like I need to go a little bit more in detail every 5 years. Mm-hmm. And that's really worked well for me. This last time, my cholesterol was a little bit high. Not bad, but it was high. And I started on cholesterol medicine. I went back 2 weeks ago, and it's fine now. So, you know, I have the complete physical, the lungs x-rayed, everything. Just have everything. Now, on my granddaddy side, he died of prostate cancer. So I watched that pretty close. Mm-hmm. And everything's fine. But I go every 6 months just to do blood work on that. Because I feel like if we catch it early, it's 100%
Sure.
curable.
Yeah, most of our plans, we don't have a limit on, and I know every carrier is different, but we don't have a limit on the preventative visits. So if someone were to go
Well,
get two.
I go twice a year just to get that blood work done. And they did a biopsy here, I guess, 3 years ago. And they did biopsies on 12 places. Well, all of it looked good except one. And they said, it's not cancer. We can assure you that. But the cells are not like the other cells. So it's, with my granddad dying of prostate cancer, I have a tendency to want to watch that pretty close.
Right. And that's the argument really for preventative care and incentivizing people to do that, is that if you can catch something early, we've had some success stories come out of Grayson County in particular, someone going in to the doctor they hadn't been in a few years, and they catch cancer at an early stage, and so they're able to treat it and have really good outcomes. And when something like that happens, you don't even think about the financial benefit. Not to say there isn't going to be one for the county, but the fact that that employee could get in there and catch something that's potentially life-saving is well worth it.
So we're not going to charge him, right?
Correct. Okay, Kaufman County is another county that's doing this as well, and they tie their wellness incentive to an annual physical. If employees complete the annual physical, they give them 8 hours of paid time off, and they don't have to pay that $25 surcharge. They also ask their employees to certify as a tobacco or non-tobacco user. Tobacco users are simply asked to complete the tobacco cessation program to avoid that $25 surcharge. And so, again, you can get creative. You can decide to, just simply offer the free day off as your incentive if you want. And in this case, they treat it just like a vacation day. So it would just be tacked on as an additional vacation day for that employee. Okay. Kind of already went over all this. A lot of questions I get about the tobacco surcharge is, how do we prove someone's not smoking? Well, it's the honor system. You're asking them to sign an affidavit. At this time, we don't have any counties that are doing the code testing, which is the saliva testing. You're simply asking your employee to be honest and sign a, can be legally binding affidavit, and they simply add verbiage in there stating that if you're found to be, untruthful, then you can be subject to disciplinary action or termination. That's really up to the county of what they want to put in there. Okay, Schleicher County, they're a smaller county, but they decided to do a few things to try to get their employees to be healthier and get some preventative care done. They do currently pay 100% of their employee-only contribution, and they actually did an annual physical health assessment, and then they asked their employees to choose to either complete a condition management program or a lifestyle coaching program. And those are programs that are offered through Blue Cross and Blue Shield, who is our administrator. And so we use some of their condition management programs. And so they asked, employees to do those top two and then pick one of the other ones, which I really like, because if you do have someone who's dealing with a chronic condition, you can motivate them to get into a condition management program to hopefully, better manage their condition and keep the cost of health care for that individual down. And we've also seen, as far as the physical exam is concerned, Blue Cross has looked at our book of business, our pool. We have about 44,000 lives right now. And they looked at everyone who had been receiving a yearly preventative exam, and they showed that those individuals cost on average about 22% less to cover. So that's really that's a really good argument for counties to put something like this in place, because they're able to actually look at the data and say, individuals that are doing this on a yearly basis are costing the plan on average 22% less. You know, why is that? It could be a lot of things. They could be catching things earlier. They're overall more aware of their health. So, you know, they're talking to their doctor. They're on the medications they need to be on. So there's a lot of different reasons why that could be. Schleifer County, I will note, is our first county that just went to our private exchange, actually. So TAC does have a private exchange, and some of our counties are looking at that option as a way to better be able to budget for healthcare costs. And Schleifer County made the jump just recently and voted to move to the exchange next year. And so they'll decide on a defined contribution for their employees to then go out and pick a number of options based on the best needs for that individual employee.
Tell me about that, just a second. That exchange is like an internal TAC participant
Correct.
policy where all the costs are shared among all the participants in that plan, or in that.
So it's, there are certain rates. It's just like when you rated a normal plan in the pool. Lisa can probably talk a little bit better about that.
On the private exchange, you can do it as a fully funded and be part of the pool, or you can offer the private exchange as you are currently on a self-funded plan. It's your option.
Okay, outcomes-based, I did mention this, and this isn't anything I would recommend to a county, especially in the first year of doing this. Maybe if the county already had a program in place for a few years. But again, we do see a lot of employers in the corporate world moving to an outcomes-based, and they are legal. You do have to give alternatives for people who can't meet these requirements, but it's basically asking employees to, hit a certain range of blood pressure, hit a certain range of cholesterol. If they don't, then they are required to get in touch with the health coach and make progress on that if they want to reap the rewards. So, for example, you might get a, $900 discount a year on your premiums if you comply with this program. Of course, you can always opt out, but my husband, for example, works for Dell Computers in Austin, and he has to, if he wants a $900 discount on his yearly premium cost, he has to, go get his exam, take his biometrics, he has to meet all the requirements on that in order to do that. And I have talked to some of his coworkers, and they say, honestly, that's what motivates them to be healthy throughout the year. They second guess certain things that they're going to eat sometimes because they're like, gosh, I really want that discount at the end of the year. So again, financial incentives are very motivating.
So there you assume that it's costing the employee something to have their insurance coverage, and here they're trying to reduce that cost.
Exactly, correct. So if they did opt out, they would pay probably, over $1,000 a year. They do already pay a contribution. So this is a way to lower that. I added this in here. It's just a sample, and again, this is included in your handout for everyone to take with them. It's just a sample contribution differential. And so I think this is a good example of a good starting point for a county. The $40 is just a sample amount. Of course, some of our grandfathered counties cannot do anything more than 5% of the cost of coverage. Otherwise, anytime you're increasing an employee's contribution more than 5%, since the beginning of the ACA, which was 2010, you're going to get opted into or pushed into a non-grandfather plan. So, but being a non-grandfather plan as yourself, you have more flexibility, just as Grayson County and Kaufman County does. Just briefly, some of the health activities that our counties are looking at incentivizing through their premiums, annual physicals, wellness checkups, condition management programs, tobacco cessation programs, weight management programs, health coaching, biometric screenings. There are certain rules that you have to comply with, but I don't think any of our counties are anywhere near, going over these rules. And basically what it says is that For any program where you're asking employees to meet a certain requirement, so let's say, for example, you say, we're going to have a competition, and if anyone who gets 10,000 steps a week, we're going to give you a certain price amount. Well, because you're asking people to actually meet a 10,000 step point, you can only make that award up to 30% of the cost of coverage. So if you do the math, 30% of $850 is a lot of money, and I wouldn't recommend any county going anywhere near that. And even for the programs that the pool administers, we do $30 gift cards for a walking challenge. $30 isn't anywhere near 30% of the cost of coverage. So again, this is probably more applicable to the corporate world where they're spending a lot more money on things. And then the tobacco cessation surcharges, you can only charge up to 50% of the cost of coverage. So again, in this case, $425, I would never recommend that being a surcharge for a county, but it's just information. This is just a little more information about what makes a plan activity-based or outcomes-based programming, and we kind of already talked about some of those roles. Again, activity-based is just saying participation, doing a health assessment or walking. It doesn't mean they have to meet a certain requirement or health standard. Outcomes-based, on the other hand, as you can see from this example, is saying such as your BMI has to be under 30 or your blood pressure has to be within a certain range. Of course, there's always legal considerations, and anytime you're putting a plan into place, you definitely want to run it by your auditor or outside auditor just to make sure that you're complying with all the new rules. We're seeing new rules come out all the time, and I'm sure you've heard about the EEOC taking legal action on some companies, and so we're constantly getting new information. And so we're actually meeting with our legal department next week to just kind of regroup and talk about, what we're doing, what our counties need to know about any tax implications or legal considerations. Of course, we want to be making sure our counties are on top of the latest and greatest. And so I'll definitely circle back with Christy once we have that meeting and just fill her in on the outcome of that to share with Titus County. Just a couple things wanted to mention. Anytime we're looking at a county's looking at implementing a wellness program from county, it is always nice to look at the health claims. And so if you can get the claims data to look at, what's your current utilization for preventative exams? Is there a way to look and see how many people are already taking their preventative exam? If you have a high percentage of people who are already doing that, then maybe an incentive for that isn't the best thing to do. Maybe you can incentivize something that they're not doing. So it's always a good idea to look at the claims data to see, what's lacking, what can we perhaps put a financial incentive in place to help increase participation in that area. Okay, already talked about the legal impacts considerations, of course. We are constantly monitoring those. I know that Christy had mentioned, the idea of, well, what if we did a price drawing for something? And it's my understanding that, and there are guides that I can provide to Christy on, what's considered de minimis fringe benefit and what's taxable. And there's no bright line number as far as what prompts something to be not de minimis. In other words, if it's under $100, that's kind of the informal IRS threshold from what's my understanding. I'm, of course, not a tax attorney, but that's always a good number to stay under. And again, if you're giving away an iPad, that could pose some issues. But if it's something that is a smaller amount, then it's really up to the county's discretion. But it's usually safe to stay under that dollar amount value on something. And then we also get questions, well, what about the taxpayer dollars if they know we're doing this? Well, my personal stance on that is that if you're motivating your employees and you're rewarding them for participation in a behavior that's going to overall help the county's health costs, because you're going to motivate your employees to be healthier, as a taxpayer who's contributing and paying for the employees' health coverage, I would want the county to find ways to help lower that cost of coverage. So if doing that means, offering some motivation and prizes throughout the year or incentives, then, for completion of a program, then I think that's not a bad way to spend the county money, and of course, as long as it is within a reasonable amount. And so a lot of our counties, they do offer certain incentives throughout the year, in addition to what we offer, just to help keep their employees motivated to keep walking, keep participating in healthy challenges, hoping that it will ultimately help the county's medical spend in the end. Okay. I have just some general information that I can kind of breeze through regarding our Healthy County programs. And the reason I share this with you is simply because there's some good programs that the county can perhaps look into. We do use some outside vendors for some of our programs, and so I'll talk briefly about them, and then, if the county's interested in learning more, I'm happy to share share that vendor information with you. Okay, so we actually incentivize our pool members in the health pool to take their health assessment once a year for $35. We have a program called Sonic Boom, and that's a walking program. We use a vendor outside of California. They have a lot of different other companies that they work with. The Benefits Value Advisor, this is a program that we're actually reevaluating right now. It's a concierge service that Blue Cross offers, and it gets employees in touch with someone to help them price shop a procedure. So let's say you need surgery or you need an MRI. You can call this number. They can look up all the different areas that are in network, all the different locations in a certain area, and they can help schedule your appointment for you. They can work out any pre-authorization, put you in touch with, all the right people to make sure that everything is smooth sailing and you're not on the phone all day trying to coordinate this stuff. And so it's something that we offer right now. But what we're finding is that it's more utilized in areas that are closer to the more urban cities, because as you know, sometimes when you're out in a rural area, you don't have a lot of choices. So a program like this might not be worth it because you only have so many choices to begin with. But it is something that we currently have in place right now. 24-hour nurse line. If you do have a nurse line or a 24-hour nurse line through your current carrier, I definitely recommend promoting this. This is a good way to keep people out of the doctor's office if it's unnecessary. Of course, if it's an emergency, absolutely, we recommend people go straight to the emergency room. But there's some times where it might be late at night, you're not sure if you need to wait till the next day, you need to go to urgent care right then and there, or the emergency room, and this is a really good resource. And this can help prevent overutilization, and it can also help save your employees a copay if they don't have to go to the doctor right then and there. I have used it several times, and they simply ask you questions. They give you a recommendation on where to go, and it's very short, it's easy you get someone right away. It's very helpful. We also put a program in place, we call it Medicine Match, and what it does is it simply gives people half off their copays for certain medications, such as diabetes, high blood pressure, cholesterol, and asthma, if they enroll in a condition management program. So I mentioned the condition management programs earlier that we have available through, and when I say we, I mean our pool members, have available through Blue Cross and Blue Shield. If the employee, let's say you're taking medication for diabetes, if you call the number and enroll in a telephonic condition management program with the nurse, then automatically that information gets sent over to our prescription benefits manager, Caremark, and the next time you go in to fill that prescription for diabetes, it's half off. So we're motivating them to enroll in the condition management programs. We're hoping that it increases their compliance with medication, and at the same time, they are in a program to help them better manage their condition. And Blue Cross and Blue Shield, this program's been in place for several years now, and they have looked at the claims data for those people who are in this program. And when you look at those individuals up against the individuals dealing with those same conditions that are not in the program, the individuals that are in this program are having better health outcomes. And that just means that they're spending less on health care, and they are not having those reoccurrent, emergency room trips and hospital stays. The Sonic Boom program I did mention, it's our walking program, and it's very similar to the device that you see people wearing around their wrist, the Fitbit devices. There is a little pedometer option you can wear in your shoe, or there is a wristband. It's a lot cheaper than the Fitbit, but we do pay a program cost per employee per month. So we only pay for those employees that are actively using that. They don't make us pay for everyone in the pool, even if they're not using the program, which is nice. So we do only pay. And some of our self-funded groups, we don't actually pay for wellness programs completely for those counties. There's some programs that are included and some that are not. So our self-funded groups, for example, Anderson County, Guadalupe County, some of those counties, their court pays for these programs themselves. They pay for their employees to participate. And so that's a setup that we just simply invoice them directly for the program. Okay, so Sonic Boom, it's great because the employees can wear that device and all the information. It gets offloaded wirelessly to a little thumb drive in a computer. They just need to walk within 20 feet of the computer that has the little receiver in it, and it goes directly to their online account. If they have a smartphone, they can use that. And they can also receive a daily email showing how many steps that they did for that day. And so what we do is we create challenges around the program, and we're in one right now. It's called County versus County. We have all the counties in our health pool competing against each other. We have about 150 counties right now that are all walking and trying to beat each other on steps. And so that's going on right now. And then if those employees within the county, if they complete at least 45 minutes of activity a day, 4 days a week for each of the 10 weeks, we're awarding them a $30 gift card. Okay, so when you log on to this program, you can see all your different steps. There's always a challenge of the day, and that's always related to their health or nutrition. Any questions on the Sonic Boom program? It is a great program. We've referred a lot of other, county entities that are not related to the pool to them. They've been interested, and we've gotten them in touch with them. So it's definitely, if the county's looking to implement something along those lines, I would highly recommend that program. They're great. Okay, we do a biannual newsletter. It's called the Healthy County Newsletter, and we also do a monthly email called Healthy Bite. And so, if the county doesn't already have something like this in place, I think it's a great way to, start off a wellness program, or just get employees motivated, or make them aware of what's available. So if you do have a 24-hour nurse line, or if you do have condition management programs that are already available, a monthly, whether you have employee emails or you can actually print something out and put in their payroll, that's a great way to inform them of the programs and what's happening. And anyone is certainly welcome to register for this. Some of the information is related to our program, but a lot of it is just general health information. So if anyone's interested, they can certainly subscribe to this. And if you don't see Titus County, actually, all you have to do to register is just enter your name, your county, and your email address. We don't do anything with your information other than send you the email once a month. And I can send, I'll send Christy the information on how to subscribe to that. Okay. And that concludes the presentation. As far as the PowerPoint is concerned, I just wanted to note that in your folders, I did include some sample materials. On the left-hand side, you see this Healthy County, Healthy You brochure, and I just wanted to share this with you. This is how some of our counties choose to communicate any kind of wellness incentive tied to their premiums to their counties. Some of them just do something as simple as a Word document. It varies. Not every county gets as sophisticated as this. Some of our counties, do want something more fancy like that. But again, you don't have to get real fancy when you're doing these programs. You can simply just do a simple form online for your employees to complete or take to their doctor if you don't have the ability to track things through your carrier. So there are a lot of options. And behind that is just some more information on some of the programs I talked about so that you can read on those. I added the preventative health coverage since Titus County is covered at 100%. Those are just some of the things that are covered now for your employees under the ACA. And then, of course, you have the presentation from today. And behind that, you see some of the information about some of our rewards that we do for our pool members. Our pool members could receive up to $95 this year just for completing participation-based programs. And the information on that is on there front and back. If you're interested in learning more about some of the programs I talked about today, just to get some ideas, the Healthy County Roadmap is front and back. And on the back of that also includes how to subscribe to that Healthy by email. But this is a way we communicate all the programs to our employees. And again, there's just more flyers in here. These are flyers that we use to communicate some of the programs that we did. So, not all of our counties have a program in place that ties health activities to their premiums. We probably only have about 7 or 8, but we're seeing more and more interest. Every year people are saying, we're ready to do this. We want to take the next step from just offering, what we have as far as the gift cards. We want to actually make it so that every employee in the county has to do certain things or else they contribute more to their health coverage. So all of our counties are at a different point, and we certainly don't, we can simply make recommendations and help them administer it, facilitate it, but at the end of the day, it's of course the county's decision on what they do, and because every county is so different. Are there any questions, comments?
Go ahead.
That's all I was just going to say, is a lot of information.
Yeah, there is a lot of information. I think there's some very, very good things in there. I know probably we're looking at, in our county, we have a very high diabetes situation here, probably a little higher than normal, probably a lot more than normal. And then cancer is a big thing.
Okay.
And that's, I think that's been our biggest cost through the years. And of course, it's just like any other plan that you might have. You're going to have those years that it just goes out of sight, and that we have insurance for that. And then you just got the healthy part. I will say this, several years ago we had I'll say another commissioner, and the company we had at that time, I'm not going to name any names, but anyway, what happened, they dropped his wife off the insurance because they said she was too heavy.
Oh, okay.
And that really made me mad.
Yeah, I don't think that would be allowed.
That's to me is completely inappropriate.
Yeah.
And this lady, well, she was a healthcare worker, type person. And she was a healthy lady, I'm telling you.
Yeah.
She was, but she was tall and everything, and that kind of, that didn't sit well
Yeah,
with
no,
me
that,
at all.
That certainly would not be allowed or legal in this day and age. One thing I did want to mention is that if the county has an AgriLife extension agent, that is a really, really good resource. Typically, every county has an ag office, an AgriLife extension office, and there's typically a family and consumer science agent. And we work very, very closely with those individuals in our counties. They have awesome programs that are available to every member of the county, and they're often very, very affordable. There are programs that focus in on diabetes, for example. There's a Step Up, Scale Down program that employees can do. It's a 12-week weight management program. So if you do have an AgriLife extension agent, I'd highly recommend getting in touch with them to see what they can do for your employees.
Well, I know we have several employees that they are members of fitness, gyms and stuff like that. So could that, we could probably find something, some way to utilize that for incentive.
Right.
All that, so.
Right. Some of our counties have looked at getting like a group rate for their county employees. So if you can work something out with that gym to say, can we offer our county employees at a discounted rate? Or in some cases, some counties have said, we'll pay you $1,000 for the year if you agree to let all of our county employees come to your gym. And so in some cases, the county gym or the gyms, they know not every county employee is going to utilize the gym, and they will agree, you can negotiate with them. And we have had some counties that have done that. So it's definitely worth looking into.
I like the gym and the working out and the walking machines and these type, especially if they have somebody there to help you set a program up.
Right.
Now, my wife, she goes to, over here at Pittsburgh at the hospital, what is that called? The Wellness Center.
Okay.
Over there, and it's really a good program, and they set things up for her. Now, she has thyroid problems, and she takes thyroid medicine. But she likes it over there. They set the program up to, she can come anytime she wants to. She can do whatever and set her program up, and she comes in and she can do her program and she can leave. What I'd like to do is see something where we encourage people to do physical exercise, things that will help them. And, I like this thing about giving, if you do this, then you get credit for this, and that would help pay for that cost of going to that gym. I hear what you're saying by just going and negotiating prices with one place, but there may be some other places that do a better job.
Right, and right. And another question would be, does the county have an area that they could set up for employees to provide some gym equipment? And a lot of our counties have looked at ways they can fund a county facility. So whether that's, at the sheriff's office, or, if you have an extra building or area that you can set a gym up. We've had a lot of counties that have done that and gone through that process from like a legal standpoint and waivers. And so if you're ever interested in learning more about what those counties have done, I can certainly share that information. So in all of our counties, of course, they don't have space. They don't want to deal with that, but it's always an option if you do have the space.
Just me personally, I'd rather them to be able to go where they want to go and set up their programs that's comfortable with them. Maybe in the sheriff's department, you could set up something like that and have that set up just for the sheriff department, to have a place to go work out.
Right.
I like to work out the incentives there. I think that's good. But our major problems through the years that I've seen is cancer and diabetes.
Yeah, so I would definitely see what your plan has available to help members better manage those conditions. So I would, definitely see if they have any condition management programs that focus in on chronic conditions, and if they do, then, promoting those, communicating those to your employees, would be the best way to go. Sometimes there are community resources available through a health department that can provide some disease management or health coaching, so that could be an option as well. But again, it's getting people to utilize those. And so we're actually, next year, we're looking at a different approach for our rewards. So right now, we just do the health assessment, we give the gift card, we do the 2 physical activity challenges, we give the gift card. But we're looking at moving to a point system for our groups. So we want to promote a number of activities, including condition management, lifestyle management, weight management, tobacco cessation. So we're going to associate a different point level with each of those activities. And we say, if you complete 7 of these, if you get 7 points, you can earn, something worth $75. If you go above and beyond and get 15 points, then you can earn this amount. So we're trying to motivate them to take advantage of all the different programs and not just take the health assessment. And we think that'll help the utilization because, again, not all of our counties are ready to move towards something tied to their premium. So we figure if we can motivate them on our end to do that, then hopefully that'll help increase some of the utilization we have of our programs.
How does the counties, or who do they put in charge of all the clerical work that's going to have to be done here?
So it's actually, usually it's handled through whoever does payroll. And how it works is, yeah. So basically it is additional administrative work, but we try to help the county as best we can. In our case, we would simply provide the reporting on who has completed and who has not. So the employee, so let's say, for example, Titus County decides that they want to start a program like this. Well, when is your anniversary date? The counties, the health plan. Okay, January 1. Okay, so let's say starting January 1, you tell your employees, we would like for you to, we're going to have a new program. You need to complete your annual exam, participate in a walking challenge, and complete a health assessment. If you do all those things during this year, then next year you stay at $0. So what we would do, let's say, for example, if we're, helping you, we would, or your healthcare carrier could provide reporting to say, these are the people that completed the activities, and these are the people that did not. So you would know who would be administered that surcharge on payroll. And a lot of our counties actually are very flexible with their employees, and as long as they, let's say by next year, Christy did not complete the wellness program, therefore she will be starting to be charged $25 a month in 2017. But the county's going to say, Christy, if you just get that done as soon as you can, we're going to stop those surcharges. And so we have some counties that are doing that because at the end of the day, they want the people to do the activities. So they're going to be flexible and say, let's say she doesn't get it done till March. Well, Christy, you're going to pay January, February, March, that $25. But if you get it done in March, we're not going to continue to charge you the rest of the year. We'll stop that surcharge. So that's what a lot of our counties do. And then also for new hires, you have to give them time, to do it. So a lot of times new hires will have, 60 days to get that activity completed. If you have a waiting period, for example, then that waiting period has to start after the waiting period. Of course, if it takes 90 days for them to get on the coverage, then you have to give them time once they're on the coverage to then have access to the programs. So, but it's it is definitely something you'd have to do through payroll to know, you'd have to administer it that way through payroll. But it's a lot of people are nervous about that, but from what we've seen, it's become easier, once they get started. And because once you have all your employees in the system, then it's just a matter of like charging certain people and not charging certain people. And luckily, most of our counties, they have high 90 percentages participation, so they're not really having to charge many people at all. Most people are just complying with it and opting in. So that's the good news. Because again, no one wants to have to charge their employees, but at the end of the day, they want to reward those employees who are taking action to hopefully help the county's bottom line. So it's a compromise.
I don't know if this is even the right question to ask this, but a program like this, would you include the retirees, ones that have retired?
No, I don't. Now, if they're
Just
on
asking.
the health plan, see, usually if they're eligible for Medicare, would they?
They're retirees that are not.
They're
Okay, so
not
they're still on the health plan.
Yeah.
Right. So because you're not going to have all retirees on the health plan, some are eligible for Medicare, and they'd be on Medicare. Then most of our counties have not included retirees for that reason, because it's too hard to track to say who's on the plan, who's not. If they're not on your health plan, then there's no point because they're not going to be contributing to your health care claims. And we definitely wouldn't recommend dependents as well, because those individuals, we wouldn't recommend including dependents because those individuals are going to come on and off your plan. You really want to get the people who are going to stay on your plan for the long term. Hopefully the employees and the spouses, you want to get those employees to be in the programs because that's who you're going to get the benefit from.
The one thing that and people that I've seen, you say, I've told my employees, I would like for you to get a physical, and besides that, it's good for you, and if you got some problems, you find out about it. The other thing is exercising and doing the proper things. Of course, anytime you eat, you got to, I like the greasy cheese type stuff, which is not good for me. But I've been very blessed through the years, and I know I have. The good Lord has really blessed me because my health has been really well, but there's other people that I know of that has not been fortunate to have that good of health. But I think exercising and checking to make sure everything's going okay, that physical once a year I think would be great. I really like to see that done, and also a place where people could go and work out where they wanted to work out, unless we come up and had, because you got several companies here in town, and there's some just not very far from Mount Pleasant. And I found out men, it really doesn't make a lot of difference. Women, they're kind of picky where they like to go or where they're at.
Yeah, one thing we do know is that a lot of chronic conditions are lifestyle related and preventable. Diabetes, high blood pressure, cholesterol, a lot of those are related to behaviors, and a lot of them can be genetic, and some people can do everything they can do and they still have elevated numbers. In those cases, yes, they need to be on their medication. Of course, they need to continue to be healthy, but there's going to be people that just cannot seem to get below that range, that healthy range, or above it. But in most cases, your lifestyle, what you eat, your stress level, how much you exercise, all those factors contribute to chronic conditions. And so that's why we do what we do. And, not all employees want to go to the gym, and that's okay. And so, if they just want to walk, but I think the most important thing is to make them aware that there is a relation between what they do and their health outcomes and what the county spends. And, really the goal is to be able to offer the level of coverage that you can now and continue that level of coverage and not have to transfer costs on to employees. And I think when employees make that connection, that their actions ultimately might have an impact on what they spend on health care, just simply from that trickle-down effect, then they do, they understand that there's something in it for everyone, that they do have to make steps to prevent, having to pay more coverage down the road. So
If you could pick two things out to do, say, this first year, what would that be?
I would say the annual exam, and I say that simply because we've had Blue Cross look at our group and tell us that, those people that are getting their physical exams are costing 22% less. So I feel confident in recommending the annual exam. Now, I'm not saying you have to tie a large amount to that. The county can decide what they want. Maybe they want to do a free day, additional day of vacation. Maybe they, want to think of something else. But anytime you're getting your employees to do a preventative exam, they're going to be better off catching things early and getting them involved in their health. I would say that I don't want to jump the gun on the tobacco. I would probably, think about your population. Is it an issue? There's no way claims can really point out tobacco users, but there are certain things that pop up that it's pretty evident they're related to smoking. So I would say maybe look at your claims data first on that, and you have a good idea on smoking in your county. Are there a lot of smokers or not? So the tobacco might be another option. As far as the physical activity is concerned, tracking it is probably the most difficult thing unless you have a program in place like Sonic Boom, because it just would be the honor system saying that people walked a certain amount of activity. But if you had a program in place where people wore the devices, you could track it that way. So it's hard for me to recommend. I mean, I would definitely recommend the annual exam, but it would be hard for me to know without knowing a little bit more about the county to make a second recommendation. Because again, also I don't know what's available through your healthcare carrier. But I would say if you have condition management or lifestyle management that's available, absolutely encourage participation in one of those two things. Because anytime an employee can get into a condition management program to better manage their condition, and let's say an employee doesn't have a chronic condition, well, there's a lot of other programs a lot of times that people can benefit from, whether that's stress management, weight management, nutrition, physical activity. So there's something everyone can benefit from in that case. So if that's available, I would say that, or perhaps the tobacco surcharge. And the reason for the tobacco surcharge would be to then motivate those employees that are using to complete a tobacco cessation program. And that's their way of avoiding that surcharge, is to complete the tobacco cessation program. So a lot of times we've talked to a lot of counties who've implemented that surcharge, and that is what got their employees to quit, because they did not want to deal with doing a tobacco cessation program, or they didn't want to pay the money. They just needed that motivation. And so we've had a lot of success stories come out of implementing tobacco surcharge. It's just that last thing that someone needed. They wanted to quit, but they just needed someone to kind of give them a little, excuse my language, kick in the butt. So.
Is this I'm a little confused. This is for your people that buy insurance from you.
Oh, no.
This is for the other, we don't buy insurance from you. We have our health care with someone else.
Right, but this can be applicable to any employer, any county. So the tobacco cessation program that I speak of, it's going to look different, of course. It depends on what you have available through your carrier. But the healthcare, the ACA, the Affordable Care Act, requires access to a tobacco cessation program for any employer who implements a tobacco surcharge. So in other words, that has got to be an alternative for employees who are tobacco users. So, if you were to do this, of course you would work with your healthcare carrier, and you would want reporting from them on who completed the annual exam. Or we have some counties who simply provide a waiver for their employees, and they say, we don't want to deal with the claims data and the tracking. We simply want the employee to take this waiver to their doctor And when they get their preventative exam, we simply want the doctor to sign off and say that they've completed it. And then they would go and hand this to payroll, and they would file it and say, yes, Commissioner Hinton completed his requirement, he's good to go. So even if you don't have access to tracking, you can use paper, and you could also use paper for a tobacco certification, just a simple affidavit. We provide, templates.
And CAPS are through UMR, we have, they have come and discussed the majority of what you've gone over. So UMR will have the reporting for us.
Perfect, yeah.
And can work, what she's talking about this morning, UMR, 95%, that's all for the same. The nurse hotline, they discussed that with us. The, anything, the urgent care, all of the tobacco system program, UMR, Tony, the CAPS have already discussed with us. So this is a good review from Carrie to, on a county level, as well as the taxpayer side as well. We wanted her to come to see, since we are using taxpayer money, what we could do. So that she could answer for us, whether the CAPS or UMR.
Well, I might add, I have Medicare. I'm not on this insurance, the county insurance, and they're doing the same thing that you're talking about. I suppose they're required to.
Medicare is that what you're saying?
Yeah, I'm going through all this same stuff with them. They were telling me they got same stuff.
Yeah.
Different words.
Say you have a walk-in program, a lot of people have smartphones. They can get on there and download one of those apps.
Correct.
Could you use that in place of what you're talking about, this?
You may be able to. I know that
I know the one I'm on, that you can go through and, with other people.
Right, right.
Kind of keep up with each other.
Yeah.
Stuff like that.
Yeah, and there may be some apps that can serve as, I know there's like apps that serve as trackers. So maybe you could do that just as a challenge, not necessarily included in any kind of premium differential, of course, because not everyone's going to have a cell phone. But yeah, absolutely. And again, going back to the tax issue, we definitely, we can't, tell exactly a county exactly what to do as far as tax things are concerned, but we try to go and we try to abide by a general, we under $100 and nothing exorbitant that the taxpayers would look at as extravagant. At the end of the day, you're doing this for participation or completion of a program that is related to their health plan. So it's to encourage employees for healthy behavior. So the court, as long as they approve it, they can justify that. But you just want to be cautious of what you're giving away. I know some companies, my sister was telling me about, they give away a car for doing something, and so again, that kind of, there's no bright line number, but the informal IRS threshold, I believe, is like $100. So again, of course, that's what you want to run by your auditor, outside auditor, but that's typically, what we try to abide by. So,
and I think all this is good. I think you look at the different options. The exercise deal is one that I really like. I think it's good and healthy for people to be active, but I can see the paperwork's really going to be a headache here, and it might be something we can look at, the elected officials responsible for their employees, and like there's their spouses on there, then they could write that down, because you're going to see your employees every day, and I know the auditor's office up here, that all that.
well, and here's the thing too.
Yeah, limited staff.
You may, and again, your carrier probably has access to a lot of the stuff. It can be automated. I know that Blue Cross has, and we don't use this for every county, but Blue Cross has some tracking system that, once that employee goes to the doctor and completes their annual exam, it shows up online, And then the employer can decide what that employee gets from completing that. Maybe it's a premium credit, a deductible credit, or a gift card. And it can kind of be administered on the carrier side. But I just wanted to, before I forget, you brought up physical activity again, and the Extension Office also has the Walk Across Texas program, which you may have heard about. And, that's accessible to county employees, and it's a great program. So I would absolutely look into that program as well. It's called Walk Across Texas, and it's administered by the Extension Office.
Okay. Any other questions? Okay. Well, thank you very much for coming today, and I especially
welcome.
thank Christy for getting us all organized and getting
Yeah,
us
thank you,
here on
Christy.
time. So,
She's been very helpful. We've been emailing back and forth a lot, so.
well, the Texas Association of Counties has always been there, and it's just like Mr. Riddle was asking about, you're not handling this, why are you doing this? You're here to serve the different counties and inform us and
Absolutely.
educate us on certain things, and I think that's really good. But we do appreciate you being here, and we are going to be looking at insurance in the near future, and I'll get a little more time where I can sit down and go through it and not be around grandkids and stuff like this, where I can understand it a little better. But we do appreciate y'all taking your time being here.
No problem. You're very
And,
welcome. And feel free to ask us, follow up any questions you have. We'll be happy to help. And again, we know, of course, Titus is not in the health pool, but we visit non-health pool members all the time and share similar information. So we're
Do
happy
you
to
have
do
your
it.
card?
Yes, sir. It is in the.
It's in here?
Right here.
Okay.
Yes, sir.
Well, that way, if we have something we want to ask you, we can call you then.
Sure, absolutely.
Anything else? All right. Do I have a motion to adjourn?
So move.
Have a motion? Do I have a second?
Second.
Got a second? Any other discussion? All in favor, say aye. 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 Thank you.
Thank you.